As healthcare moves away from traditional fee-for-service models, providers need a strategy to stay competitive. That's where Strategic Healthcare Partners comes in. We offer expert consulting and ongoing management oversight for providers looking to form an accountable care organization. From financial feasibility analysis to helping you choose the right ACO in a crowded market, SHP provides the clarity you need to make informed decisions and transition to value-based care. Learn more at shpllc.com. Welcome to Beyond the Stethoscope Vital Conversations with SHP. I'm your host, Jason Crosby. Today I'm joined with my partner in crime, Aaron Higgins, as we interview our guest, Craig Kilgore, in the first of 2 episodes. Craig is the CEO of Coastal Vascular and Vein Center based in Charleston, South Carolina, where he recently took the helm after 10 successful years as CEO of Charleston ENT and Allergy and 23 years with the Holston Medical Group in Kingsport, Tennessee, where he served in various leadership roles. We discuss the challenges of remaining independent, staffing, and other helpful insights from Craig. Are you ready for this vital conversation? Let's get started. Hello, everyone. Jason Crosby here, and today we are joined by Craig Kilgore, CEO of Coastal Vascular and Vein Center out of Charleston, South Carolina. Craig, appreciate you joining us today. How are you?
Great. Thank you, Jason.
Fantastic. Well, I'll tell you what, we've run across Craig in different paths over time, and we know you've had a pretty successful background on the independent practice setting, and we really wanted to kind of pick your brain and get your insight on that sort of path that you've been on over the last couple decades in your career here. So we want to give our audience sort of a background check or a summary of your background as to how you arrived in your current role.
Sure, be happy to. I'm originally from Tennessee and graduated from ETSU with an accounting degree and was able to work for IBM while going to school. So that kind of started my career with a good foothold, knowing accounting, but also having, some experience with computer systems. So I was able to get a job with a multi-specialty group that was growing in Tennessee, Holston Medical Group, and started as the IT manager and operations, and then also CFO, and eventually the CEO. I was there for 23 years, before leaving that position, and then joined Charleston ENT and Allergy in 2012 as the CEO. Was there for the past 11 years, and just recently joined Coastal Vascular and Vein Center. So I've always been with independent practice. I just enjoy working for physicians. That may be a little bit strange, for some people to understand, but I just really have a tremendous amount of respect for what they do, and it gives me a lot of enjoyment and satisfaction to be a part of the delivery system.
That's very interesting. So as you started out in that IT and you had the finance background, how would you say being in those roles and having that early on in your career helped you as you got into the more administrative and CEO roles?
Well, it was really interesting because my first week with Holston Medical Group was spent in Burlington, Vermont, actually training to use the IDX computer system. So, my background with accounting, I understood, you had to figure out how to make money, revenue somehow. And of course, the IT part of it was like, okay, we have to install computers to use them. But anyway, it was like a perfect fit. It was just like, okay, I had a lot of, folks that taught me, medical billing and collections and revenue cycle. I didn't know it, when I was 25 years old, starting there, but I had a good foundation. And so I think it was the best potential, training and experience for me was to, come back from that first week and then install, the IDX system, throughout the multi-specialty group.
And certainly you've seen a lot of change in healthcare just from an IT perspective. And most certainly that's been fast forwarded a little bit with COVID. How have you seen changes in private practice in a post-COVID world?
Post-COVID, so it's been an interesting time period, I think, for, depending on what specialty you're in. You either had some significant impacts, to the practice, from COVID and related to the aftermath of COVID. But some actually did very well. I think primary care overall, did pretty well, during COVID. But what we've seen overall in the specialty world is that the volume really fell off. I mean, because of COVID, and depending on what the specialty was, but I know in ENT, there were significant impacts. Maybe not in every specialty. I know ophthalmologists did really well, but for some specialties, it really fell off. And honestly, the volume really has been pent up for several years, and it's came back, very strong, really in the second half of 23. And so not so much the first half, but the second half of 23. So, it's kind of been it's been a long recovery, for a lot of the medical practices. But I know that now some of the payers are even complaining about their medical loss ratios being too high because of the volume in 23.
Right. Suddenly everyone's seeking care that they previously put off for the last 4 years. And certainly we've seen with our clients that there's just been this kind of rush to get care, and it's been certainly overwhelming. So maybe you could help frame it by how big of a clinic that you work for today, how many providers you have?
Yeah, there are 8 physicians and 4 PAs, and so vascular surgery is not one of the ones that that most people know a lot about, because of the unique procedures that we do, and often life-saving, limb-saving procedures that are done. But the practice is in a growth mode. We're looking to expand, and it's an exciting time. Mainly there's a lot of changes in South Carolina with the CON laws. And so, that will work in favor of private practices being able to expand and grow their revenue streams through ambulatory surgery centers, and in an appropriate manner. I mean, they can't be, too careless with the growth, but I see it as a great opportunity for independent practices.
Maybe dive into that a little bit more as well, Craig. You were not only in another state pre-COVID, you were in your current state as well, and you've since gone to another group. So you've got a really good pre-post-COVID environment experience with multiple groups. How would you say some other challenges from an administrator or CEO's role would you say has evolved to where now you're kind of in post-pandemic, this is just how things are going to be, where they weren't a few years ago? Other challenges that maybe that the COVID situation caused to you as an administrator, whether it's staffing, there's of course lots of folks having staffing issues, maintaining staff, training, expansion strategy, things of that nature. What are some of those things you can speak to?
Number one problem across the board is staffing. And, it started with the stimulus money, that came out, and people were made whole during the time, which was great. I mean, it had to be done, or else it could have been a catastrophic events. But, so people were paid, during that time period. Then as soon as that period ended, then employers, were needing, all kinds of people to work. Some people chose not to go back to work or found other industries to work in. And so healthcare was hit by, this inflationary pressures that were generated, by the COVID time period. So, wages for medical assistants and front office people escalated very rapidly. And again, you had the impact of the volume not coming back as quickly. but yet, the cost of doing business continued to increase. And so, it put a lot of pressure, on practices during that time period. And we really haven't seen any relief in the wage escalations. And so, what was, normal in 2019, is just a memory now. And, the cost of hiring and retaining staff is just tremendous. And it's not the glamorous positions that it used to be to work in a medical office. So it's kind of like it's really hard work, and sometimes you have to put up with patients that are unhappy or confused, and so it's a huge problem.
Yeah, and like you said, it's across the board, across the different industries. Staffing just remains there, and customer service to boot. Yeah, I can imagine. Let's keep going down that path. As far as evolution and impact into the market, especially in this post-pandemic space, how has the payer environment also evolved or maybe become more challenging due to COVID?
Well, it was already, complicated prior to COVID in terms of getting any significant or material increases from payers. But it's actually gotten a lot more difficult related to increases. But just like I said, I think is impacting how much their customers, the employers, are having to spend on healthcare. They're trying to keep the unit cost as low as they possibly can, and so it's more difficult probably than ever. The other factor I think that's happening, and at least in South Carolina, probably in other parts too, is the consolidation of payers. There's just not that many now. I mean, you have the Blues, you have United Healthcare, you have Cigna, to some extent Aetna, but not really. And so you really, from a commercial payer standpoint, lots of times you only have maybe two major commercial payers, Blue Cross and a little bit of United Healthcare. But, that's probably, one of the biggest factors is the lack of competition in the commercial payer market.
Let's speak a little bit more into that as well. You've got 30 plus years in the independent practice setting, right? And of course, every few years you get the tug of war between those that fight to employment and trying to remain independent. And it's quite a struggle for folks in your role to maintain that independent practice setting. What role would you say that the payer should have in trying to preserve that status as an independent practice setting?
Well, you would think it would be they would embrace, private practice groups and try to help support them, in every way possible, compared to, paying more to health systems for the employed physicians. But it just is it's an industry that just doesn't follow normal economic guidelines, as we already know. I mean, healthcare, particularly on the medical, on the physician practice side, doesn't always follow. It's not necessarily supply and demand, related issues, but the number of physicians that are employed now compared to any time in the past. I think I saw something, I don't remember the statistic, I hate to quote numbers, but it's just the increasing number of physicians that are now employed either by a hospital system or private equity, is just increasing to the point where, the physicians that are coming out of training, their fellowship programs, they are not looking to go into private practice. Some of it is the risk associated with being your own company and the exposure that you have financially to actually making the investment and then growing the practice. They would prefer to have a job where they have an income and they have hours, and they don't want to take the risk associated with private practice.
You being in the specialist setting, primary care, of course, can, sort of partner and team up in the ACO type of model. You being a specialist, a little bit more challenging, but clinically integrated networks have become, of course, a very popular model as well. And I know you've got some background in working in that sort of setup and structure. Maybe speak to that as far as your independent specialist experience in the CIN and how that maybe can help others thrive as well.
Yeah. So going back to my days in Tennessee, so Holston Medical Group started as primary care group, then grew a specialty practice, and eventually became an ACO, and they are doing very well. They are now, a delivery system all contained in the multi-specialty group. So that model has been embraced by the payers, by Medicare. And so it took a long time, for that actually to change the reimbursement focus from unit cost for primary care over to care management, but it's really happened, and it works very well. For specialists, the specialists are really kind of not tightly integrated in CINs. We can be a member of multiple CINs. We don't have to have a exclusivity with any particular CIN. And so that gives the specialist a lot more, flexibility. And I just don't, I mean, there may be some CINs that are hospital owned, and, their medical practice is a closed practice, which I'm sure there are, but, for private practices in the specialty area, the biggest thing that we compete on is our accessibility. And so we're more accessible than the closed systems. We're equal to their quality, if not higher, and we bring a better value. And so the cost of our procedures done in ambulatory surgery centers are 20 to 30% less than the same procedures done in hospital outpatient departments or inpatient hospitals.
A lot of our clients have participated in CINs and tend to be on the larger side. It seems that the smaller doctors shy away from those. So I guess in your opinion, what are these sort of challenges that a smaller practice might be facing right now? How could that be a part of a CIN? Maybe they are trying to avoid being bought out. What are the challenges that they're seeing from these bigger groups?
I think one thing is, and it's just a matter of sometimes the smaller practices will not, maybe they don't have the type of person that understands, how to contract with payers or how to, maximize their contracts with the CIN, or, sometimes they might not be doing a great job on their revenue cycle, which is so critical. And so it's just, and I understand the conundrum. I mean, they don't think they can afford to hire somebody, that has experience and talent to better manage their practice. But yet if they don't, then they're going to struggle. And, I think that's a real, very common problem, with smaller groups is not attracting, the level of experience and education, not necessarily education, it's really experience, that they need to successfully run their practice. Whether it's, CIN or just a PPO network or whatever, I mean, it all requires really understanding, what kind of contract that you're getting into. So, I don't think it's unique to just CINs. I think it's just, in general, just practice management.
In terms of the challenges, you see more with the smaller practices, because to Aaron's point, we see it with a lot of our smaller hospital clients as well, sort of that gap of resources that's available to them in-house. is far more limited than the larger systems naturally, as you would think. And so it sounds like it obviously translates on the practice setting side as well. What are some ways or initiatives, or if you've outsourced, what are some ways you've helped overcompensate, or you've seen the practice that you've been associated with compensate for those gaps in resources or talent or function or whatever the case may be? What type of initiatives would you put out there that you guys have tackled?
I think it's a great question. So it's kind of it's both on the physicians and also the practice leadership. Is networking and participation in professional associations. So whether it's MGMA, tremendous resource there for practice administrators to lean on and become networks, and they have specific specialty networks or whatever that you can join, and their message boards are really helpful. I know with ENT, it's an organization called Ascent, ASCENT, and it's an administrators only network of about 1,000 members. I was the president of that in ENT, for last year. Yeah. And so it's a great organization. And so, I encourage people to, some people don't really try to learn, but I think that's huge. I also think for the physicians, sometimes they don't think they get a lot of value out of their specialty associations, but I encourage them to really, reach out, because they can be very helpful. I don't know all of them, but I do think that the ones I'm familiar with, provide a lot of great resources for practices. And so, I think sometimes the resources are out there. It's just that you have to make an effort, to go find them.
Great point. Yeah, I tell you, one of our IPAs that we work with, you hit it right on the nail there. That probably one of the greater benefits of even being on the IPA is the administrator networking.
Yeah.
The lunches, the meetings, what are you doing about this? What are you doing about that? Just the dialogue and being able to meet each other is of tremendous benefit.
Yeah. Even, speaking to that, here in Charleston, prior to COVID, we had a network of at least 15 to 20 independent groups, multi-specialty primary care and specialty groups that would get together. We didn't have a formal organization, but it was just kind of a networking and sharing. Of course, that was another casualty of COVID, that kind of disintegrated. And, some of those groups are now owned by hospital systems, which is, the trend that we're seeing. A lot of, some fairly significant practices now are, hospital employed versus independent. I just, me being a private practice, guy, I really hate to see that.
You've been listening to Beyond the Stethoscope, Vital Conversations with SHP. This has been a production of Strategic Healthcare Partners.
Your hosts are Jason Crosby and me, Aaron C. Higgins.
This episode was produced and edited by Nyla Weed.
Our social media content producer is Jeremy Miller.
The transcriber is Heather McKnight, and our executive producers are Mike Scribner and John Crew.
For more information about SHP, the services we offer, including the back library of episodes, episode transcripts, links to resources that we discussed, and much more, please visit our website at shpllc.com/podcasts.
Thank you for listening.
You already know that understanding your data is key to improving patient outcomes and financial performance. But how? At Strategic Healthcare Partners, our analytics services help turn your EMR and other data sources into actionable insights. From identifying areas for improvement to guiding you through implementing changes, SHP supports you every step of the way. Our performance analytics service dives even deeper, providing custom reports that help you stay ahead in the transition to value-based care. Unlock your data's full potential with SHP. Learn more at shpllc.com.